Body Logic Physiotherapy, empowering people to achieve better health.
In hindsight, yeah. Well, I think that, to be honest, I think that having that stereotypical good posture and keeping that upright spine all the time, I think just stiffened everything up.
So do you see those prevalent beliefs as unhelpful?
Oh yeah, absolutely.
Yeah.
Absolutely. It's massively unhelpful. I mean, we are conditioned from such a young age to think that our backs are fragile and that we've got to protect them by keeping them straight, especially when lifting or loading. And I mean, it's unfortunately that's. I mean, it's just weird. I sort of almost, I still look at that box and go down to, and I'm like, what the hell am I doing? It's like that. It's absolutely unhelpful.
Welcome to part B of our two-part special on posture and back pain. In this episode of the Empowered Beyond Pain podcast, brought to you by Body Logic Physiotherapy, Pete and I chat to patient voice Joe, again from episode 14, as well as to researcher and physiotherapist Nic Saraceni. Posture is clearly a topical topic, and we've received lots of great feedback since posting the last episode. Mandy, who's been experiencing back pain for more than 20 years following a fusion, had her mind blown after realising she has had muscles switched on that don't need to be, and by learning to relax them, her pain decreased. We also heard from a fellow Kiwi who had injured their back twice and was experiencing psychological worries and fear. They reviewed the podcast as absolutely stunning and a must listen, and pleaded with people experiencing similar emotions to listen over and over until the messages sink in. We are absolutely humbled by these messages. Please keep them coming. You have no idea how much they mean to us. Reach out via @EBP Podcast on social media, or better still, leave a review wherever you're listening. Anyway, on to today's conversation, all about posture. What is good posture? What is terrible posture? Why should we perhaps lift with or around back? What should our sleeping posture be? And much more. One thing Joe talks about was his openness to change, his cognitive flexibility, if you will. We see this as an important attribute in helping people move forward, because if you're fighting for your limitations, it's hard to move past them. So with that said, whether you're listening or watching on YouTube, let's get into the conversations, and we'll start by playing Fact 6 from the 10 Facts About Back Pain paper, which is linked in the show notes, as well as all the references discussed in today's episode at www.bodylogic.physio/podcast. And then we'll head straight into conversations with Joe, Nick, Pete, and I. Remember to ask, is there more to pain than damage?
Back pain is not caused by poor posture.
How we sit, stand and bend has not been shown to cause back pain, even though these activities may be painful. A variety of postures are healthy for the back, and it's safe to relax during everyday tasks such as sitting, bending and lifting with a round back. In fact, it can be more efficient. We're welcoming back Joe, who was on episode 14. The topic today is posture, and posture is a really common scapegoat almost, I suppose, for back pain. But it's a really common belief that people think this is something that I need to be mindful of. And we did discuss some of these things back in episode 14, but I really want to kind of hone in on this whole postural story for you. So can you tell me about that?
I guess, where do I begin? Okay, so naturally I've got really terrible posture. I mean, I sort of slouch. I'm always sitting back in my chair, and I've got what a lot of people say is terrible posture. I sort of stoop but I guess when I had my experience with my pain, I sort of changed all that. It was weird. So as soon as I sort of thought, well, maybe posture is part of the reason why my pain is so bad. So, almost overnight, I started sitting upright, never sort of relaxed. I was always, trying to do these things. And I tell you what, it didn't make anything better really. So, I mean, I guess I changed the way I stood, the way I sat, the way I slept, everything changed when I sort of had back pain, and I thought that it would make things better by keeping everything upright and straight and give everything a chance to heal, but really I think it just made things a bit worse.
So it's interesting that you kind of had these rules around posture, Joe, And they provided a number of things. You said sitting, standing, bending, lifting, sleeping even.
Oh, yeah.
Where did you get them from?
Oh, goodness, probably TV, newspaper, media, articles, the internet, Googling back pain, how can I treat my back pain? It's like, 5 different postural techniques, blah, 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 blah.
Yeah, okay. And from healthcare practitioners as well?
Look, I mean, I guess, as I said, I used to have what a lot of people would call terrible posture. I think I sort of slouch and stoop over a bit. So, I mean, I've been getting told my whole life that I've got bad posture. And so I was like, oh, well.
So you were primed.
Yeah, that's right.
To think that your posture was a cause.
Yeah, absolutely. Well, I thought, well, what can it hurt to try and have a better posture? So, yeah, absolutely. And then I sort of that sort of fed into I wanted to also get my core nice and strong, and so everything was sort of upright. But yeah, it was weird. I was always sort of.
And what did it feel like to be? Obviously before you had back pain.
Yeah.
You were relaxed and slouchy, and you didn't have back pain.
Loose. Yep.
And you didn't have back pain. It wasn't a problem. Once you got back pain, you changed all of that. What was it like to have to think about holding your posture straight all the time?
Exhausting.
It was mentally, physically?
It's sort of like a workout. I mean, if this situation, this straight back stuff, is not how I want to be sitting. So I guess I was working so hard all the time to sort of have that posture. I was exhausted.
Was it mentally because obviously you're having to think about it all the time as well?
Yeah, well, I mean, on top of that, because it sort of fed back and my back was really sore and niggly, it was sort of like every single time I sort of went like that or like this, or something would twinge or hurt, or it was sort of weird. It was exhausting to just sit up all the time. I mean,
and what about movement? So because you were trying to hold those postures when you moved as well, you said?
Absolutely. I mean, you always get told lift with a straight back, don't bend too much, don't bend when you lift, try not to twist, don't load and twist. You sort of get these
was that at work that you got told that? Or?
I think it's in all the workplaces I've ever worked. I mean, you always see signs, and even on a box, you get a package that's, 20 kilos. There's a sign of 2 people lifting a 13 kilo box with bolt upright postures and bent knees and, making sure they're not bending at all.
Yeah.
It's like, I mean, 6.5 kilos each. Just bend over and pick it up. But I mean, but you sort of get conditioned to think that straight must be good for your back.
Yeah.
And you just completely neglect the whole range of motion that your back is sort of capable of.
And did that make sense to you at the time?
I guess, as I've said, you see it on the walls, on boxes, on packages, at work, on the internet. You just get conditioned, I guess. Well, I certainly got conditioned to think that, having a straight back was good for your back. And so, it did make sense. Even though as an ex-sport scientist, you sort of think, well, hold on. You're always telling people, when you exercise and go through the full range of motion, if you're doing a bicep curl, I mean, it's a pretty simple exercise, but, go from straight to all the way up. You don't just work that sort of range of motion. You go through the full range of motion. So it's sort of weird. It's sort of like you get conditioned to think, no, straight back. But then that's sort of so off with the way you think about every other bit of your body, which is go through the range, move. But so yes,
so why the back?
It made sense, but it also doesn't make sense.
Right.
So
in hindsight, it doesn't make sense.
Especially in hindsight, it doesn't make sense at all.
Right. So how do you see it? Obviously, you're one person out of a lot of people who have back pain.
Yeah.
And so we can't generalize you to others, but what is your understanding? What was the relationship between posture and your back pain, do you think?
In hindsight?
Yeah.
Well, I think that, to be honest, I think that having that stereotypical good posture and keeping that upright spine all the time, I think just stiffened everything up. I think that when I was only working one range of motion in my back, which was bolt upright, I think, of course, if you hold any joint in your body still, or put your arm in a cast or put your leg in a cast, that when you first start moving, that's going to hurt. You know, it's going to be stiff. It's going to be sore. And the problem is that I was sort of making my own cast for my back. And then when I felt that pain, I thought, oh, well, that's because that movement's bad for me. So I better go back to being bolt upright. Right. And because that was the only range of motion I was in, that was the only range that was pain free. Yeah. So it's just bizarre, really. I mean, yeah.
So when you started to change, because clearly you're not sitting bolt upright now. What was that like to think that actually, how was it to think that that might not be the case?
Oh, look, it was actually liberating because, I think I'd had such a long history of what I was doing not working, that I was fortunate that I was pretty open to change when I had when I got the right help. So I was happy to really just punt all that old information and just try something new, because I thought, well, what have I got to lose if this doesn't work? What am I losing? You know, I'll just end up going down the surgery route anyway. So it's like, well, why don't I give something new a shot? And then obviously once I got to be able to do everything that I wanted to do anyway, I was sort of like, well, this is better. My pain's decreased. Why don't I just do what's natural?
So did it seem strange to be given completely opposite information than what the common belief is?
Absolutely, but I was such a willing victim. But yeah, it did. What I guess the thing that crossed my mind was about 3 or 4 months on when I'd changed everything. I was doing everything completely different. I was lifting with a rounded spine, just because I was thinking, well, I mean, it makes so much sense. I mean, if you're always lifting with a straight back, and then you go to lifting with a curved spine, you might hurt yourself because you're not conditioned to lift in that way. Yeah. But if you start light and condition, you can lift what you're conditioned to lift the way you're conditioned to lift it.
So your exercise phys training tells you that.
And absolutely. Yeah. And so I just thought, well, about 3 months in, I was wondering why I got the other advice in the first place. Right. I just thought, well, this is so obviously the right way to go. I mean, it just like, so you're telling me I should move naturally, and then my pain also we went from a 7, 8, 9, 10 sort of range, because back pain is horrible. Everyone out there who suffers from serious back pain knows how debilitating it can be. So when my pain was going from these high levels to low levels, doing what I wanted to do anyway, I was thinking, well, why the hell was I ever given the advice to move so unnaturally? It just didn't make sense to me. So,
And what about those around you? Because as you say, it's very common in your workplace as well.
Yeah, absolutely.
Like, those messages are common. So how was it for you to kind of break those posture rules in your social environment, your work environment, at the gym, et cetera?
Well, look, I mean, it was very easy for me to break those rules because, I mean, I was just felt so good. I was going out of sight. I felt I was moving again. I was doing things that I hadn't done for years, and I was stoked. So I mean, it was very easy for me. But I remember I was lifting in the gym one day, doing a really nice bent back deadlift, and just everything was nice and curvy, and it was feeling great. And a boss of mine went past and he said, "Geez, you're going to do your back lifting like that." And I thought, I actually said to him, I said, "It's actually funny you say that, because this is the very sort of behavior that's helped me get over my back pain." And he just, oh God. But it's amazing how prevalent that information out there is, that you've got to lift with that really neutral spine.
Yeah.
But
and it's big in gyms, right?
It's big in gyms, it's big in workplaces. I mean, it's amazing. I mean, as I said, it's on every single delivery you get that's over about 10 kilos. There's a picture of someone picking it up using only their knees. Lift with your knees, not with your back. It's like, well, lift what you're conditioned to lift, and make sure you go through your range of motion is the advice that I would have given myself back then. Yeah. But it was easy for me to break the rules, but I started getting more and more because, I mean, at this stage, I had a history of back pain, and I was going to work still. So, I mean, everyone knew that, you know, I had a bad back. Now, everyone knew that I had a bad back. It was just, you know, from 3 years earlier that I sort of heard it, and I never came good. So everyone sort of knew. And so when they saw me in the gym doing all these things, I got a lot of questions,
Right.
and it's amazing how quickly I sort of found out that it wasn't just me who had a history or an issue with back pain. There were so many people, and family members, friends of friends. There are so many people dealing with this. It's a huge problem,
It is.
and all of them have the same beliefs around.
Right.
If I lift with a neutral spine, I'm less likely to damage my back.
Yeah, right.
And then slowly, the questions became more, oh wow, you're getting really fit, you're getting really healthy. How's your? I mean, God, I was getting asked for about the next 6 months. Like, how's your back doing all that? It's like, well, my back's really good. My back's back to being pretty normal.
Yeah.
And then slowly, other people who I knew had issues as well started asking me for my exercises. To which I sort of said, look, my advice would be to go and see. My problem isn't your problem.
Yeah.
So I would do this in consult with
Health professional.
with professionals, because I mean I can't say that you've got the same thing that I have. But I mean, I definitely pointed them in the direction of where I sought help and where I thought that they should be looking. And a lot of them have since had really effective treatment and are back to being normal. I mean, I've got friends of mine, one of them in particular, I know he's had an issue with back pain since he was about 20, and he's almost 60 now. And I mean, and he's now absolutely living the dream. He's killing it. He doesn't have a problem anymore. And this is just, you know, all because he just sought the right help and I guess was willing to ditch his previously held beliefs around.
So do you see
posture.
those prevalent beliefs as unhelpful?
Oh,
now, if you look in hindsight.
Oh yeah, absolutely. Absolutely. It's massively unhelpful. I mean, we are conditioned from such a young age to think that our backs are fragile and that we've got to protect them by keeping them straight, especially when lifting or loading. And I mean, it's unfortunately that's. I mean, it's just weird. I sort of almost, I still look at that box and go down to, and I'm like, what the hell am I doing? It's like, but it's absolutely unhelpful.
How hard do you think it will be to change that?
Well,
it's a question I ask myself every day in my career.
Unfortunately,
because I reckon there would not be a person I would see that comes through my door. Well, that's not entirely true. It would be the absolute majority of the people I would see who would seek care for back pain, who would hold those views. Not everybody, but almost everybody.
Unfortunately, I mean, I think on an individual level, it's very easy to reach an individual.
Yeah.
If you, but maybe not easy is not the right word, but it's possible. It's doable to reach an individual and in a one-on-one, session, appointment, an hour long, to get them to think about these things and to change. But to change it on, I mean, I don't know the numbers, but there are millions and millions and millions of people worldwide suffering from back pain. So to change the message as a whole, what an impossible task. I mean, and I do know that there is a fair bit of resistance out there to change.
Have you seen that yourself?
Oh, to a degree, but I mean, a lot of the time when I'm talking to people, it's on a one-on-one, and they sort of go, well, and these are people that know me and trust me, and they're friends of mine, and so and they know where I was and where I am, and so it's quite easy for me to talk to friends. So I don't see I guess I don't see the issue with everyone. I speak to individuals, and I think it's possible to reach individuals, but how do you reach 50 million people one at a time. It's impossible. And unfortunately, it's such a large scale problem that to help people one at a time when it's
one of the problems we have is that it's legislated that you have to educate people who are in manual jobs around
ensuring that they live incorrectly.
It's true.
And
if we touch on a bit of the research, we know that there's not a single study that shows that teaching people how to lift better, so-called better, reduces back pain.
I read,
but we still let's legislate.
I read some nonsense study about, because I sort of, after I changed my ways, I sort of thought, well, where does this message come from? And correct me if I'm wrong, but it came with cadaver spines and loading them and bending them, and then the tissue would break down. They went, oh well, the tissue there broke because we moved it in this dead spine, and so that must be bad for you. But I mean, if you did the same thing with any joint and a dead joint, it would wear out if you used it. But that then doesn't take into account the fact that we lay down new tissue and we're living.
Yeah, exactly.
So, I mean, if that's
big jump.
if that's where it all came. Oh, and what's the other one? They put a pressure meter into a disc, and then they bent the spine and the pressure went up. So they went, oh well,
that must be bad.
Yeah.
Loading makes you stronger.
Yeah, that's right. Oh God. Anyway,
we discussed that in episode 4 quite in detail actually. I kind of want to round it up with a couple of kind of key take homes for people at home in terms of with posture. This whole idea, there's the ergonomic industry. I mean, you go to any big office or workplace, there'll be signs saying this is how we want you to sit. Keep your screen at negative 10 degrees, knees and hips at 90 degrees. Keep your back straight. What are your thoughts about that now?
Oh, look, I mean, it's all quite funny, isn't it? Like, whatever you do, you must not sit comfortably. It's just you must be put in a position of maximum discomfort. No, I don't know. It doesn't make any sense. I mean, we're all so different. We're different shapes. We're different postures. We're different. We're different in so many ways, and so the idea that there is an ideal sitting position for everyone it just doesn't make any sense. So I would argue against it. If that got brought up and someone said to me, oh, look, this is the way that you must sit and that's the best sitting position, I would argue for the negative on that one.
That's interesting. I'd love to just pick on one little thing that just triggered that. And that's sleeping, because we often don't talk about sleeping as a posture, but we know that sleep is an incredibly important thing for people. We know that back pain can really, really impact on someone's sleep. And a sleep-deprived person's greater predisposition for pain, anxiety, worry, fatigue, ill health. Generally, it's such an important thing. What were your thoughts around posture and sleep?
So I got told that sleeping on my back or my side was better than sleeping on my stomach for my back. I always found it really comfortable, and I do now again find it really comfortable sleeping on my stomach.
Right.
It's just how I've always slept. But when I was going through my issues with pain, I changed because I wanted to have a more back positive posture. So I ended up sleeping on my side, made sure my hand was supporting my head, so that was all straight with a pillow between my knees, because I heard that was a good thing to do for your back.
Right. So you keep your spine,
and so I was keeping my spine exactly the same way as I'd kept it for the 16 hours before. That was also exhausting. So I just even when I was sleeping.
And how was that to sleep like that?
Oh well, I think that I know of people that sleep like that, who that's how they sleep, and they've always really enjoyed it, and it's fine for them. But for me, it was terrible. It wasn't that relaxing. And every single time I woke up, like rolling towards my side, I'd quickly go, oh shit, and I'd feel like I was falling. I had to go back to, my correct sleeping position. Yeah. So.
Because the other thing that taps into is what we call vigilance. It's like constantly thinking about something.
Oh, absolutely. I was worried that if I went into too deep a sleep, I might roll onto my stomach and then screw my back up.
Right. Okay. So that kind of constant thought on posture created a whole abnormal focus on your body that became really unhelpful.
Just became a monster.
Yeah.
Absolutely. Yeah. So no,
that's helpful. Sorry, getting back to this.
I mean, we're laughing about this now.
No, it is not funny.
But it's not funny.
No. When 2 years ago, when I was going 3 years ago, when I was going through all this, it was not funny at all, and it had an absolutely terrible and detrimental effect on my life, my mental health, my job, my activities, everything. It was I was in a really, really horrible place. I only laugh about it now, I guess, because just the ideas that I had around how I was going to help myself are sort of the exact opposite, I guess, of what ended up helping me. So it was it's kind of weird irony. It's a weird comical irony that which is why it's kind of funny now.
Exactly.
Yeah.
Awesome, mate. I want to summarize with the whole idea of this this one size fits all is what you sort of mentioned before. I think the other way to think of that, which I often use, or to kind of rationalize this, is trying to say that everyone needs to wear a size 7 shoe. And we've all got different size feet. Some are longer, some are shorter, some are wider. And for those people that have size 7 feet, that's going to be really good advice.
Yeah.
But for everyone else, it's kind of like you're trying to make them fit into something that their body's not really natural or designed to do.
No.
And you sort of mentioned at the start that you've always had terrible posture. I think it's pretty safe to put that in quotation marks.
Yeah.
And this
pretty normal posture.
Sounds pretty normal. I mean, like look at us. I'm kind of off camera now, but we like to vary our postures. We relax when we're sitting. We get up and down frequently.
Yeah, if it's comfortable, keep sitting that way.
Absolutely.
And then if it gets uncomfortable, I'll go, oh, well, that's a bit uncomfortable now. Or that's comfortable.
And it doesn't mean that sitting up straight's dangerous or bad for you or anything like that either.
That's right.
But it's about variability.
If it feels good, do it.
The best posture is your next posture.
Yeah, that's right.
Cool. Thanks, Joe.
Thank you.
No worries. Thanks heaps, guys.
What a great chat that was. We reckon Joe's story is so relatable and, unfortunately, so common. And he articulates his thoughts so well. So we've heard the patient perspective, intertwined with some research, but now let's hear about what the research has to say, and specifically what Nic Saraceni has to say, a researcher and physiotherapist whose whole PhD topic is on lifting posture and low back pain. We're here with some researchers who are both researchers and clinicians. Nic, particularly, your whole PhD is on lifting related to low back pain. Mm-hmm. So, both as a researcher and as a clinician, what would you say some of the common misconceptions are that patients have when they come and see us as clinicians related to lifting and low back pain?
Definitely, for me, without a doubt, the most common misconception is that there is a optimal way to lift, that you should keep your back straight and you should bend your knees. And that is the best way to lift to prevent back pain. But also, if you have back pain, that is definitely what you should do. That is a dominant misconception.
Yeah. And what does the research tell us around what actually, what advice would we give patients like this? So what's the fact, I suppose?
Well, part of my research is all about that exact question, where we're trying to figure out if there is an optimal lifting posture. And probably in a researchy kind of answer, there might not be. That we don't know if there's an optimal lifting posture, and definitely at this stage, not for everyone. So the fact would be that at this stage, we need more research in this space. But often it's the opposite of what we think. That when we looked at a review that we did, most people actually with back pain were keeping their back straighter, following that advice, and bending their knees more. And that comes across in my systematic review, but also in David Nolan's. So the fact is that we don't know, but it doesn't look like that keeping your back straight and bending your knees more is going to help everyone.
Yeah, sure. So that's kind of talking to that, I suppose, that ergonomic advice in terms of we often hear that people should be keeping their back straight and bending with their knees and lifting with their knees. Do we know that lifting occupations are related to back pain? Like if we have manual labourers and manual workers, is there an association there with those occupations and having back pain?
So there is. So if you're in a manual job, what the evidence would say is that if you lift a lot, lift often, more than 25 times per day, and also if you lift heavy quite often, that you're at greater risk. Your risk goes up as the heaviness goes up and the regularity of lifting goes up. But we're not sure why. So there is elevated risk slightly, but if it's to do with posture or not, we don't know. It could be a bunch of other things, such as, how much load is going into your back, how used to that load you are, what your capacity is like, what your fitness is like, how you perceive that load. Does it feel heavy for you or does it feel light? All these things seem to maybe matter, maybe more or as more than posture, or at least, they're we don't really know, but they might be just as important as posture. But yeah, you are at slightly greater risk.
Yeah, sure. And is there kind of, we know that there's lots of ergonomic interventions, there's programs out there that are teaching people how to lift and, how to position their spines correctly. What's the evidence for those? Are they effective at reducing back pain?
In a short word, probably not. Yeah, short answer, probably not.
Probably not.
No.
Is there any evidence for it, Nick? And the systematic reviews of ergonomic interventions to reduce the risk of back pain?
In summary, no. Yeah, nothing that we know of. That it's probably not helpful. So it isn't helpful based on these two systematic reviews that showed that either people aren't following the advice, so they don't follow it, to keep your back straight and bend your knees and that kind of ergonomic advice, or it's just not a useful advice. So, yeah.
So if you think about that though, Nick, it would seem from your review and Nolan's review that they are following the advice.
Yeah, true.
So it sounds like option one probably isn't the case, because this idea of, well, if they weren't following the advice and they just like bending over and lifting the way they normally would, then maybe that's why they're not sore. But in actual fact, so Dave Nolan's review showed that they were lifting with straighter backs and more bent knees. So it looked like they were following the advice.
Yeah.
And the people with back pain lifted more like that than those without back pain, who had tended to be more of a stoop lift than a straight back squat lift.
That's right.
So it would suggest that actually people with back pain revert back to the advice they've been given at least.
That's right. Yeah. Once they get back pain, people are tending to follow that advice.
Yeah.
We don't know what happens before they get back pain, whether they were lifting in a different way.
Yeah.
There's only one study that looked at that, Tim Mitchell's study, and it showed that there was no differences. But once they get pain, people seem to revert to this advice where they keep their back straight and bend their knees. And obviously they've got pain doing that. So like you're saying, Pete, it's probably not that useful.
So one of the things I suppose I'd ask as a devil's advocate on this, because there are some really strong beliefs around back pain and lifting, what were the limitations of the studies you reviewed? So how much did they lift? How heavy were they? Did they lift a lot? Was it repeated lifting? Because you've said that your risk factors are heavy lifting and repeated lifting. What are those studies actually done?
So they looked at up to 12 kilos. Some of them are really light, like a pen. But others were with weight of up to 12 kilos in a box. So that was and that sort of encapsulates, your regular occupational lifting, I suppose, but nothing heavy. So that was one limitation. It's light lifting. And there's a bunch of other limitations, like, how many they lift. Usually it was only 3 lifts that they captured.
Right.
So there's some weaknesses, like you're saying, to that research.
It's not really capturing the risk in a sense. If you talk about heavy lifting, repeated lifting, 25 lifts minimum in a day is where the risk is. They're not that research would suggest that there's a bit of a jury out at the moment.
Definitely, yeah.
Around this.
The jury's definitely out for sure, but if it was pointing to a direction, if the jury could point, it would be saying that people with back pain are tending to actually keep their back straighter, not actually around their back more. There's nothing that points in that direction.
Yeah, we just don't have the evidence at this stage. And a part of your PhD is trying to help answer that obviously.
Yeah.
And we're pretty keen to get you back to talk about your PhD next year when you'll have a lot more answers for us.
Yeah.
Around and maybe you can give us a bit of a taster about not of what you've found because it's not published yet.
Sure.
But what your study's done to kind of bridge some of the gaps in the existing literature.
Yeah. So some of the gaps are that we recruited people who are in lifting jobs, that either they've had a long history and career in a lifting job and they've had no problems with pain, and or the other group that we recruited are still in lifting jobs but have difficulties with pain related to lifting. So we've captured groups like no other study has previously, relevant cohorts that and then tested them, how they lifted. So we got them to lift up to 10% of their body weight 100 times, and we got them to lift and twist in a task that replicated work tasks. And we measured lots of things: knee bend, trunk speed, back position, all the things that people think forces might be relevant. And we captured that to try to address some of these limitations.
And you used really accurate measurement tools where I think some of the previous studies had not all of them, but a number of them had pretty limited measurement tools to look at accuracy, what was happening in the lower back.
Exactly, yeah. We tried to capture curvature in a way where a lot of studies just looked at, the whole trunk almost.
Yeah.
So people think that curving the back's important. Previous studies didn't look at that. We actually looked at, what's happening in the curvature component of it.
So I'm interested, Nic, given, this is an area that you're obviously interested in and you're researching in, and you're also a clinician. So if a patient comes to you and they've got back pain and they've heard it lifting, how do you kind of, and they say to you, look, I don't want that again. It was a horrible event.
Yeah.
How do I prevent it? Where does the evidence sit now at the moment for what we can say?
Sure. It's a great question, and probably how I would go about it if I put my clinical hat on, would be that I would ask that person questions around a number of factors, not just about how they lifted it, but to do with how often they're lifting it, what's been happening around the time of the onset of pain. Because what we know is that, posture might be one part, but there could be a whole bunch of things around, not sleeping, more fatigued, changed part of their activity levels. So I'd be wanting to know what's surrounding the context around when they got that pain. And then I'd get them to demonstrate how they're lifting. If lifting's still giving them trouble, I would look at how they're lifting and then seeing if we could alter anything, change anything, and try to, reduce it going forward so that they would get back to work and get back to lifting how they previously were.
Okay, so there are a number of things that kind of emerge in that as I hear it, and that is around risk factors. So we know from the research that lifting per se can be a trigger. So awkward sudden lifts, repeated lifts are a trigger of back pain. But that risk massively increases if you're fatigued or tired at the time. So that tips into some of these other things around potentially stress-related factors, sleep, general activity, levels of conditioning, etc.
Yep.
So it looks like there's other risks involved. The other part that I think it's important that you highlight is that someone's risk of pain is multifactorial. And so just focusing on one aspect of like how you lift may be missing a bigger story. And so that exploration around that. But at the moment, we don't have a lot of research evidence to say, this is the way. We do have some evidence to suggest that there are more efficient ways to lift. And that contradicts a lot of common belief that actually, a round back lift looks like it's more efficient in terms of the amount of load that you can generate, force you can generate in the body. But that has to be explored further. I think one of the things that we look at when we kind of look at people's risk is the critical aspect of history taking, but also no different to spraining an ankle. You would never tell someone to sprain an ankle, never to invert their ankle again. You would say, look, for a period of time, just we back you off, we'll get you mobile, we'll get you strong, we'll get you fit. We need your ankle to be able to move in all directions so it's competent to load in a variety of ways. And backs should be able to do that as well. And I think that's the story that often gets missed around backs, is that backs health is related to ranges of movement. You want strength in a variety of ways. You want to teach a workforce to be able to adapt to load in a whole variety of ways. Because, each one of us would come across manual workers who will say, I can't do optimal lifting in my job. It's not possible. So if we're not equipped to do it, then we may be vulnerable when we go to do it. Do you think that's a reasonable way of looking at it?
I'd say so, Ben. Sounds like it's pretty evidence-packed. And
I know we've had a discussion about the issues around, foot strike for running.
Yeah.
Around back posture and foot posture.
Yeah.
There was a whole rage around midfoot running or rear foot running and shoes. But really the evidence isn't so flash on that. And maybe the same thing fits with the back. It's like fitness for lifting. So there might be some efficiencies around certain patterns of running, like high cadence, but it looks like the exact foot posture is not so critical. Maybe that's more what we should be thinking about around backs.
Yep. And I think that it's practical, like saying to someone, like you're saying, keeping your back straight for every single lift doesn't seem that doable, especially from the data we captured. But in real life, I mean, it's just definitely not practical all of the time. So making people strong and resilient to certain positions and movements that they're having to be exposed to at work when they're lifting, and they're being capable in a range of postures, like you're saying, probably it might be better than saying do it exactly like this every time, but we have to test it, I suppose.
Yeah. And I think the other thing that kind of springs to mind as a clinician is that there's so much fear. And we know that lifting is probably one of the most feared activities, or bending and lifting for people with back pain. And it's often linked to an experience where they've actually hurt their back when they do bend or lift. And so it becomes a memory that they guard against. And we know that when you're frightened, you tend to overprotect that area. And overprotecting can create more load on the area. And so that potentially can set someone up into a cycle where they overprotect an area, they overload it, they don't move it as much. It compromises the health of those structures. That leaves them more vulnerable to the event again. So there's that whole other space around building people's confidence in their back to go back to lifting normally. Yeah. And the question then is, what does normal look like? And that's something I think your research will give us a better insight into, as you've looked at survivors, people who've lifted in an industry for more than 5 years, repetitively, and haven't hurt back pain. So they will give us a bit of an insight into what does a person who survives a manual work look like in terms of the way they go about doing that.
How are they
that'll be
interesting
themselves? Exactly. That'll be interesting.
It will be. Answers shortly.
Some common sense answers from us both, from you both, which is great. I want to sort of finish with what about people that don't have back pain? So we've gone advice for people with back pain. What about the general population that hasn't got a problem with their back? What advice should we be giving them when they're lifting things?
Do you want to go first, Nick?
Yeah, I think we've touched on a number of these things that Pete and I have touched on today around looking after your whole health, for example, keeping yourself fit and strong and active. They apply to obviously people without back pain too, and building capacity for the job that you have. So if you're a heavy landscaper, you need to be strong and fit and healthy and capable to do that job, so that seems like a job you're ready to do. You're prepared for it. All that advice is for people without back pain as well. And probably I'll say if you're lifting in a way that doesn't cause you trouble, I wouldn't change that. Whether that's curved back or straight back or bent knees, if it doesn't give you any trouble, I'd see no need to change it. That would be probably how I would address it.
Yeah. Yeah, I kind of look at the issue around lifting as someone who says, I want to run. So we often hear people who've got a sedentary job and they get out in the weekend and just go nuts in the garden, and they're not conditioned for it and they hurt their back. And I go, what have I done? It's like, I can't lift now. And we go, well, if you were someone who was sedentary all day and then you went and run 12 Ks in the city to surf and you said my knees and ankles sore, well, go figure. You're not conditioned to run 12 Ks. Yeah. You are not conditioned to do 500 repetitive bends and heavy loading because your body hasn't been conditioned to do it. And I think this idea that some things are good or bad for the body is something really unhelpful. We know the body is an amazingly adaptable system, and that we are good at doing things as long as we grade into it gradually. So this idea of things being good or bad, I think is really unhelpful. This idea of being fit for task, and I think you've touched on that, of like getting people, lifting is a wonderful way of keeping your back strong. Before we had gyms, we had gardens. Then we gave our gardens away and we got gyms. So it's like, that's what we're designed for. And you look at countries around the world, lifting and bending is part of our world. It's something we should be encouraging people to have confidence in, I think. It's something that it should be safe for people. And the idea around that is going, what are the most efficient ways for you to do that? And so keeping strong, keeping fit, keeping engaged, variability in movement looks like it might be something also that could be important for the health of any system, be it a joint or, the spine, and caring for your whole health. That'd be the key things that we would look for. But in saying that, we are human beings. We get pain. I get back pain very frequently, but the key thing is what you do about it. And I think we always have these messages: if you hurt your back, you got to rest and protect it. We know that's not helpful. If you've got some serious pathology, sure, you might have to lay off. But for the majority of back pain, if you're engaged with activity, you may get soreness. It may be a reason to just grade down, but not to arrest it and avoid it. I think that's the other big message I put out there for people who might be listening to this, is that, back pain can be scary, but it's very rarely dangerous in terms of, doing some serious damage to your health, as long as you're sensible and put sensible parameters around it and grade into it and make sure that your body's fit and conditioned for the task.
Maybe a last message of hope. I mean, I've seen so many people that, have lifting pain. They come in with horrendous lifting pain and they keeping their back straight or, tensing up a lot and really worried about lifting. And so many of them are able to get back to the work that they want to get back to by maybe slightly changing the posture or changing the way they move a little bit, or just exposing them back to things that they couldn't do. So gradually, like Pete was saying, building them back up to the things that it happens all the time clinically. So if you're out there and you haven't lifted and you're avoiding lifting, then maybe that's the one thing that you want to try and get back to.
And interestingly, you say that, Nick, because from a clinical point of view, if lifting is something that you avoid, that will be the first thing that we'll look to get you back to. So because we know that avoidance will make you more vulnerable to the thing that you're avoiding, we're engaging with it as long as it's done in a graded and sensible and a safe way is the way to get back to it. I think it's terribly important message as well.
Yeah, absolutely. Often people sort of think, if lifting's the thing that caused me the pain, then I've got to stop and avoid doing that because that's bad. But actually progressively doing more of that, what you're saying is that it will make them better and more protective and less likely to have pain.
And the pain related to lifting may just be a sign that you need to get more sleep, that you need to care for your health a bit better. You might need to lose a bit of weight, that you might need to engage in more regular physical activity and fitness and care for other aspects of your health. And I think there are things that we tend not to see people think about. And it's only when they reflect around what was going on at that point in time that they can see sense in that.
It just doesn't seem to be purely about posture.
The only other thing I know I probably need to add into this, the other very common belief that I'm sure you guys see, and I would almost invariably see this, is this idea that you should engage your core when you lift. And that's probably the other most common thing I would see. We did a research study a couple of years ago. So Emily Campbell and a couple of other researchers were involved, where we got people to just lift 15 kilograms off the ground. And we looked at their abdominal muscle activation standing as they lifted, lifting the weight and putting it down. And we found the abdominal wall muscle, internal obliques, so the key core muscle group that people were taught to engage were no more activated in lifting than they were just at rested standing. So basically, the muscles don't naturally engage when you lift. Now, what patients are told is that, when you lift, you got to brace your core as you go to do it to stabilize your back. And I think the common misconception there, I kind of describe that as a bit like, if you think of what these muscles are designed for, they pull you to the floor. Mm-hmm. So they work against your back muscles. So they put double work on your body. And in fact, you can do a simple test yourself by doing repeated lifting with your core brace versus your belly relaxed and see what it feels like. It's much harder work when you engage your core. Mm-hmm. So in actual fact, we're teaching people to preload their backs and pre-stiffen their backs before they do a task, which is, if they do that repetitively, they're going to fatigue way quicker. So there is not good evidence actually to suggest that if you don't do it normally, why would you teach it? It'd be how I would look at it. And often we have to train people out of bracing their core when they lift. I actually find that it takes a lot of pressure off their back because they're just not loaded. They're not double loading. They're not just carrying the weight of their body and an external load, but they're actually generating an internal load by co-activating their core muscles. So that's probably the other thing that comes as a surprise to people when we look at retraining them to get back to manual work, is that it's actually not smart to consciously engage. And that idea of, having to pre-contract a muscle before you do something, it's not anything we do with any other motor task. Mm-hmm. We don't do it when we kick a ball or play a musical instrument or, do any other motor activity, but somehow we've done that for the back, where we've created this belief that this back is so damn vulnerable, you got to pre-tense things before you do it, which actually loads the body more, it fatigues you more, it puts you on alert more, it probably decreases your confidence to doing stuff, and it certainly doesn't improve your performance.
Yeah, exactly. And Dave Nolan showed in his paper that actually people were in pain, were tensing their, like Pete's saying, their abdominals more. They were stiffer and more co-contracted in their abdominals. Then more than the people without pain.
Yeah. And the other way that I like to explain it with patients is like, we've got lots of cranes here at Curtin at the moment. There's lots of buildings going on. Cranes have the cable at the back. So when they lift something up, they put tension on the cable at the back to lift that thing up. Bracing your core, tensing your abdominal muscles is like also putting a cable at the front to pull it down while you're lifting it up. It's like extra tensing your bicep and your tricep at the same time. It just doesn't really, it's not conducive of efficient movement.
No, exactly. So the cable at the back looks like your back muscles, your butt muscles and your hamstring muscles. Mm-hmm. That's where your cable sit. And in fact, your hamstring is probably a critical cable at the back end if you're thinking of a crane. The other muscle group you want to get working, I would say, if you're doing lots of bending and lifting.
Exactly.
Absolutely. Awesome. Thanks, gents. Really appreciate your input.
Thanks, Kev.
So there you have it. Another stellar episode. If your reaction to the previous posture episode is anything to go by, we'll brace ourselves, but not our cause. If you found this valuable, please help us help you help more people by spreading the word. Share this on your socials, or better yet, send it directly to someone with a personal message. Who knows, you may just be the catalyst that helps them reduce their pain and get back to living. Plus, when you do something kind for someone else, you get just as much, if not more, benefit than the receiver of the kindness. As always, show notes, including the infographics, resources, references, links, and a transcript, can be found at www.bodylogic.physio/podcast. And until next time, we hope you remember to ask, is there more to pain than damage? Have a fun fortnight. Please note, what you heard on this episode of Empowered Beyond Pain is strictly for information purposes only and does not substitute personalised, high-value care from a licensed and trusted healthcare practitioner. We are all individuals and need to be assessed and managed as such. Theme music generously provided by Fervin and Cash.